Hello, everyone. Thank you so much for joining us today. We're really excited for this event. I see our attendees are flooding in, so we're going to get started because we have a lot of wonderful stuff to cover today. So you are here for a conversation with Idah Mukaka Nambeya and SLF Partners. My name is Ruth Ann. I am a development officer at Stephen Lewis Foundation. And just to start off, I'm going to read a land acknowledgement. The offices of the Stephen Lewis Foundation are located on the traditional territory of many nations, including the Mississaugas of the New Credit, the Anishinaabe, and the Haudenosaunee, and the Huron-Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We acknowledge all Indigenous nations who were, are, and will continue to be in relationship with this territory traditionally named Tekaranto. As an organization, the Stephen Lewis Foundation acknowledges that our physical presence in Canada is a direct outcome of the settler colonial state whose policies of expulsion from the land and cultural genocide continue to impact Indigenous communities today. The Stephen Lewis Foundation also acknowledges that oppressive and inequitable socioeconomic and political systems in Canada continue to perpetrate this legacy of racism, intergenerational trauma, and structural inequality, and that this legacy is directly linked to the disproportionate impact of HIV on Indigenous communities within Canada. These ongoing forms of colonialism in Canada are linked to ongoing colonialism in many parts of the world, including the countries in sub-Saharan Africa where SLF Partners work. Today, we will hear from our partners in Zimbabwe and our Senior Advisor, Idah Mukaka Nambeya, joining us from Zambia. Zambia and Zimbabwe, like many of the countries in which our partners work, have been immensely and irreparably damaged by white European colonialism. The Stephen Lewis Foundation is committed to the principles of social justice, equality, and solidarity with our African community-based partners as they face the continued effects of the HIV and AIDS pandemic in sub-Saharan Africa. Consistent with those values, the SLF commits to a journey of ongoing learning, reflection, relationship building, and solidarity with Indigenous communities in Canada. So again, thank you so much for joining us. We're thrilled to have this opportunity to speak with Idah and our partners. To start, I'm going to ask Idah a couple of questions about her recent visit to Zimbabwe, and then we are going to bring the partners on. Just a couple of housekeeping things. We will have a Q&A section at the very end, so if you have questions that come up during the panelists speaking, please put them in the chat. We will bring them up at the end of the event. And if your connection drops, if you have to go, this event is being recorded, so you will be getting a link to the recording after the event. Oh, Idah, we just lost you. There you are. Hi, can you take yourself off mute? Hello.
Hi.
How are you doing?
I'm doing well.
Lovely to see you and hear you. So I just wanted to start off just by hearing a little bit about how your trip was. I know you visited 3 organizations that we're going to hear from in a little bit, but this was your first trip international since COVID. So I'd love to hear how it was sort of in comparison to previous trips, how you felt about the trip. Yeah.
Thank you, Ruthen. My trip to Zimbabwe, I would want to start by saying that it was really a special visit to me. And I was excited, anxious, and I was really looking forward to go and see how the grandmothers were doing. My experience was a little bit different from when I visited before the pandemic, the COVID-19. I will say that I was really welcomed by the staff, as Sipiwa, who is on this platform today, said, "Oh, wow, your visit is a motivation. We feel so motivated. I mean, we thank the SLF for sending you to come here physically and come and visit us." So it was really that special welcome, and it took me back to when we started visiting long before, when I was a field rep, because I really felt like I was really welcomed. And coming to the grandmothers, the experience was really different. When I visited the grandmothers in both organizations where I met the grandmothers, which was Chiedza and MASO, when I went, the welcome was a little bit quiet. In the past, when I've visited, the grandmothers, when they know the SLF rep is coming to visit us, I've always been welcomed by songs, dances, that confidence that, someone is visiting us. But this time, there was that quietness. When I went to visit the MASO grannies, they welcomed me. The granny who was at the door came with a sanitizer. I was sanitized maybe 3 times or 4 times. That I was happy. They were really sensitive to the COVID-19 rules. And I was so happy, but there was that quietness. So when we came in a group now for them to start talking, they were looking at each other like, I want to hear from you. So once one grandmother actually started talking, then she opened the fire. So everyone now wanted to talk. You haven't taken my name. I want to talk. You haven't done this. So you could see from being quiet, now there was fire. Everyone wanted to talk. Even when it was visiting, they actually told me to say, you have to leave Gweru maybe by 1 or 2 because I needed to travel back to Harare because it's like 4 hours, 5 hours. The grandmothers wanted me to visit all of them because they all wanted to showcase what they've been doing in their homes. And it was really interesting. Now that they started talking, there was now, everything was coming out. The challenges they were going through during the pandemic, the COVID-19 pandemic. They were now talking about the challenges they've had with their grandchildren while they've been on lockdowns and all that. So a lot now was coming out. And I ended up spending, going past 2 when they said I was going, and they were like, oh my God, Idah, you have to go. I said, I know the grandmothers. Let them do what they want. I will go. I will be there. So I made sure that all the grandmothers that really wanted me to see, even when they said, no, it's enough, you've talked, they said, no, we need to talk. I loved that and I liked that. I was like, oh, wow. So the work has been going on. That quietness in the beginning scared me. I was like, what's been going on? But once they all started talking, then they really showed me how they've been committed to supporting their grandchildren while this pandemic has been going on and all the efforts that the organizations had been doing. And, when I came to the Chiedza grannies, it was also the same. Once one started talking, that's when everybody opened up. I'm like, what's going on? Are they not sure? Is this showing that they don't have the hope? Are they losing hope, or what's going on? So I kept wondering about that quietness in the beginning, and in the end, they started dancing. From welcoming me with the dance, they started dancing in the end, and so that experience kind of like. It spoke a lot to me that, probably they've not been visited in a long time. And for them, that visit was like, is it true we are being visited after a long time? Or maybe they are not probably not going to be visited, but then just became normal. Very happy to just know what's been going on, the commitment they've been having, even the challenges that they've been having with their grandchildren, and the efforts the community-based organizations are making. The efforts Chiedza or MASO are making in making sure that the organizations continue to support the grandmothers and their grandchildren. So that was kind of like a bit of experience that I got during that visit, and I was very happy to be there. Yeah.
Absolutely. Yeah, it often just takes one person to get the ball rolling, right? And then everybody joins in and opens up. That's great to hear. So, on this visit, I'm sure you heard plenty of stories, and we don't have time to listen to them all, unfortunately, but I'd love it if you could share just one story that stood out to you that you heard on this visit.
Yeah, thank you, Ruth. There were many interesting stories from the grandmothers. Grandmothers always have. And I think one story that really touched me on that visit was Gladys's story from MASO. So this is a grandmother that's been living with HIV, and she explained how she had the self-stigma and she didn't want to out and all that. And the grandmothers from MASO, one of the grandmothers kind of like pulled her to come in the group. And she said, you know, her sister died of AIDS and left 4 children under her care, and they were very young children, and she had 2 of her own children, and then she was bringing them up together. And when she joined the group, kind of like she opened up, she found the grandmothers were so open, and she got the strength to supporting her children and her grandchildren. And then as she was talking, before she could actually touch about the income generating activities that they were doing, that the Stephen Lewis Foundation supported MASO to have the grandmothers start to rear the chickens, she just told me, like, you know, I actually lost my son last year to COVID-19. And I was like, oh, really? She said, yes. So I only have 1 child because I gave birth to 2 children. So 1 died of COVID-19. But the way that she talked about it, it's not like in the past, you know, in the past when, you know, the grandmothers would talk about their children, how they've died, they would cry and cry. But it was like one story, like, you know, my son died last year to COVID-19, and I was very sad, but she rushed to talk about her income generating activities that she's having, how she's having challenges to sell her chickens, and how the organization is trying to help them to make sure that they sell their chickens, and trying to bring back the members, because, you know, when there were lockdowns, the grandmothers couldn't meet again and all that. And so they were talking about how they are trying to make sure that things start to move on, and how they are struggling with their business. And the way that she talked, actually, she's the one that actually made all the grandmothers start to talk, because she just went on and talked about what was happening and how MASO was helping actually move on. They said, you know, they missed their groups, because once they started staying in their homes and starting to stay with their grandchildren, who they said, oh, our grandchildren are like the husbands in the home now. During lockdown, we discovered they were really like, you know, bossing us around and all that, and how the organizations were trying, how MASO was trying to have the communication skills, you know, between grandmothers and grandchildren. And so I felt that that story really touched, because she had the courage, she had all that energy to really go on and explain and how they are trying to build the group, not really dwell on a son that had died last year to COVID-19. So I thought that story was so special to me after listening to her, because it's not easy. Not many people probably can behave the way she behaved. And that shows you how the organization are trying to make sure these grandmothers are together and they can support each other, even in terms of when, you know, they have the issues, like, you know, they lose their kids, they can come together, they can, and they can move on. So I felt that was really special to me. Yeah, thank you.
Yeah, that's a great story. And yeah, I know we're going to hear more about the grandmother groups and the challenges that they've had during COVID and not being able to meet. Yeah, so I'm going to transition right now and introduce our panelists. If you can come on camera so everyone can see you. Oh, Idah, you can stay on camera as well.
Okay.
Yeah. So once we have everybody here, we are really honored and thrilled to be able to speak to you all today. I'm just going to read your bio so everyone gets a little snippet of your story and your credentials. So first, we have Tinashe Machikano is the Children and Youth Coordinator for MASO, Midlands AIDS Service Organization. He has worked with MASO and directly with grandmothers and children under their care for 5 years now. And he holds a master's degree in child rights and childhood studies and a degree in sociology. Vimbai Mutendereki is the executive director of Musasa. Vimbai is a women's rights lawyer with over 14 years of experience in gender and gender-based violence programming, and she's been with Musasa since 2011. She holds a Bachelor of Law degree from the University of Cape Town and a master's in women's law. And during her time with Musasa, she has been a part of many key milestones for the organization, including setting up the first ever call center for survivors of violence, as well as setting up one of the first community-based shelters in some of the hardest hit areas of Zimbabwe. And lastly, we have Spiwe Chakawa is a development practitioner with over 18 years of experience focusing on vulnerable children, young people, and women in the context of HIV and AIDS. And she believes that vulnerable groups and communities are at the center of any development solution. She holds a master's degree in development studies from the University of Science and Technology and an honors degree in psychology from the University of Zimbabwe. So from these very impressive biographies, you can tell we are talking with experts in the field, and I'm really excited to hear about the visit and hear about your programming. And so I will pass it over to Idah.
Thank you, and welcome back to Tinashe, Sipiwe, and Vimbai. I think without wasting much time, we will definitely go into the overview. Maybe you can give a quick overview of your organizations and your main areas of work. We might start with Tinashe, then we can go to Vimbai, and then Sipiwe, you can be last. So Tinashe.
Okay, thank you. Midlands AIDS Service Organization, it's a community-based organization which was formed in 1991, basically to respond to the effects of HIV and AIDS in the Midlands province. So since 1991, MASO has been working with communities who have been affected and infected by HIV, and it also started an OVC program in 1998, where we realized that due to the debilitating effects of HIV and AIDS, a lot of orphans were also left under the care of grandmothers, and some of them were left heading households. So MASO also started looking into orphans and vulnerable children as well. Then from there, since 2007, MASO started the behavior change program, which was also looking at educating communities about how they can change, behaviors in relation to HIV and AIDS, to ensure that communities are aware of the behaviors they can practice so that they protect themselves from HIV and AIDS. With the Stephen Lewis Foundation, MASO has continued to support grandmothers who were also affected, and some of them are infected by HIV and AIDS. And these grandmothers are taking care of orphaned and vulnerable children. So as MASO, we are also focusing on making sure that these grandmothers are able to provide adequate care and support for the children under their care. And also they themselves have got psychosocial welfare, because due to the effects of HIV, some of them lost their children, some of them lost their husbands, and some of them were infected in the process. At the end of the day, we are trying also through the support group model, we are building their resiliency so that they come together as grandmothers. In English, they say there is power in numbers. If we come together and be together as a team, we can go far. But if you want to run fast, you can go alone. So as grandmothers, they find their power, their comfort in the groups that they are in, being the support groups. So there are a lot of income generating activities that they do in the support groups to help them, provide adequate care and support to children under their care. Then we also have other programs like the DREAMS programs, where we are looking at the adolescent girls and young women, reducing the risks of getting HIV. So we are also raising awareness in relation to HIV and AIDS through challenging harmful practices and gender norms. Then another program is on food and nutrition security, is also running at MASO. We also have another program where we have the community-led monitoring system, whereby we have community volunteers who are tracking people who are living with HIV and ensuring that they adhere to treatment, and even they get their viral loads tested on time where there is need. So this program builds the relationship between the health facility and also the communities to ensure that they have proper access to art, drugs, and treatment in related diseases. So generally, that's the programs that MASO do, but under the Stephen Lewis program, we focus on grandmothers and who are taking care of vulnerable children.
Thank you. We can pass it on to Vimbanashe.
Thanks very much. Thanks, Idah. So Musasa is one of the leading organizations in Zimbabwe that works on gender-based violence. The heart of our work is really the direct services that we offer to survivors of violence in the form of counseling, legal services. We also have a hotline for survivors. We have shelters as well across the country where we are able to accommodate survivors on a temporary basis. They can also come with their children just so that they're removed from situations of violence. And I know Idah got to visit one of those shelters as well. We also have a prevention arm in the work that we do, because for us, it's not just the response, but also the prevention of violence. And one of the key models that we use is the SASA model, which looks at prevention of HIV and violence against women, because we know that there's a strong relationship between HIV and violence against women. And so Musasa is also implementing that. We also have an advocacy arm because we know that laws and policies are also important to support response and prevention of gender-based violence. So we advocate for laws, different reforms that we see as necessary as an organization in our country to make sure that survivors of violence are able to get support in the face of their experiences of violence. So very briefly, that is what Musasa does.
Thank you, Vimbai. Sipiwe?
Yes, thank you, Idah. Chiedza Child Care Centre is a community-based organization rooted in the communities. It was started in 2001. The idea was to help children who were left orphaned by their parents, because that time Zimbabwe didn't have access to ARVs, so there were a lot of deaths due to AIDS. So the founding members wanted to create a home for orphans. But with the advent of ARVs in Zimbabwe and with the guidance of Department of Social Welfare, it was prudent that we run a community-based organization instead of an orphanage. But anyway, we have an advantage of physical space because by then the founders had already bought a 5-acre piece of land, which I think Idah saw that is a hive of activities because we are now using it as a project site, not as an orphanage. So over the years, then the organization has been initially focusing on community-based, home-based care, but later on with the coming in of ARVs, the organization then evolved to begin to respond to the broader impact of HIV and AIDS on families and children. So that then led us to have 4 pillars that we are operating in. That is education. Our education pillar, we focus on out-of-school children mainly to give them second chance education. Then we reintegrate them into formal schools. We also have health and nutrition. Health and nutrition mostly is providing direct food to children and also responding to the direct impact of HIV on children. That is children who are HIV positive and their parents. We also have a child protection pillar. That's where we have volunteers who work in the community to identify, support beneficiaries and also refer for other services. Then we also have the economic strengthening pillar, that is livelihoods. That's where we usually work with caregivers and mostly where our grannies are being supported to ensure that they are able to better care for their children through income generating programs. And in all this, we work with partners in the community, the government line ministries, and other organizations. And our support from Stephen Lewis Foundation is really broadly to support our holistic support or our holistic model of all these 4 pillars, because they are not implemented in isolation. So they are implemented together: the child protection, education, economic strengthening, health and nutrition. So Stephen Lewis Foundation has really been supporting us to continue with that model over a number of years now. Thank you, Idah.
Thank you all for the brief overview of your organizations. We will go into the second question. And this question is really, how did you feel when you heard I was coming for an in-person visit? How did you feel? I know already I said how Sipiwe said that was the motivation. So I would like to hear more about how you felt when you heard about my visit. Thank you. We can start with Tinashe again, and then Bimbai, and then Sipiwe can come last. Thank you.
Okay, thank you. I think
Tinashe?
when we heard that, am I audible? Yes, I think when we heard that you were visiting, it was really something that was interesting for us, because, you know, we knew that somebody was coming to also witness the work that we are doing, despite the circumstances under COVID-19. We know that maybe the pandemic, you know, affected the nature of our work, and also it kind of, you know, reduced some of the impact, the milestones that we had achieved as an organization. But it was also an encouragement to say, you know, someone is coming to witness and also learn and have an appreciation on what we were doing. It kind of, you know, gave us a motivation, and that we are going to be on the map for some time from now, you know, onwards. So we also, were motivated, and we knew that, you know, there was going to be an opportunity for our organization, and even for our grandmothers as well, to interact with you and to share their stories and experiences with you there also, because we knew that you are also, you know, one of the people who has been working directly with grandmothers, who knows, you know, some of their problems, some of their issues, some of their challenges. So it was like, you know, a learning visit, especially from my side. Thank you.
Thank you, Tinashe. Bimbai?
Yeah, so when I heard that Idah was coming, what really stood out for me is it was one of our first visits, physical visits, since COVID lockdown. So that was exciting. And also my first visit in the position of the director. So it was also very exciting for me to host that type of a visit for the first time. But I think what I really liked was Idah didn't come and say, I want to go specifically to the shelter that Stephen Lewis is supporting. I want to go anywhere. And so for me, that spoke to the interest that was there from Stephen Lewis, even beyond just the support that they're given, but just the interest in the organization broadly. And that was also very exciting for me. So I really felt encouraged and excited to host Idah.
Thank you, Bimbai. Sipiwe?
Yes, thank you, Idah. For me, you've said it very well, but I was feeling under pressure in this position, dealing with the impact of COVID on the organization, on beneficiaries, and on myself as a leader. So hearing that you were coming, I was so excited to say, at least I'm going to tell someone what I'm going through. I'm going to share this burden. And sometimes when you're here and this is all happening, the COVID and everything, you begin to wonder if the funding partners are really aware of what we are going through and how they're going to be supporting us. So I couldn't miss that opportunity either. I couldn't miss that opportunity for me to have you allow you to see it on your own, what has really happened. So it was really a huge relief. I was really happy. I don't want to lie. I felt it was a chance to debrief, to tell you everything that's going on. Even when you wanted to talk to beneficiaries, I felt like, I think we also need to tell you, things are really tough for us here. But I felt motivated that at least someone somewhere, they're thinking about us and they're thinking about this. And it was also our first physical face-to-face visit after COVID. I think everybody else was scared and they're still scared, but we were brave enough to come and risk getting COVID infected. And I was trying to manage that before, so don't worry, things are okay. But most people would not take that. They are still calling for virtual M&E visit and all those things. But this was really different. And I really want to appreciate you for taking that decision. That was bold. Thank you.
Thank you so much. I also enjoyed myself, just to come over and visit and listen from you people. It was really interesting. I was really happy. Thank you so much for sharing. I think we can move on to the specific questions, and I'll start with Sipiwe. I think I would love to hear from you, to share the various income generating activities that the grandmothers are involved in. I'll tell you one that the grandmothers kept on telling me when I met them, kept on saying, "You've been making Vaseline. Look, my skin has changed. I'm looking, my skin wasn't like this when I joined the group. Now you can touch my skin. It's so soft because of the Vaseline that we have learned to make." So I think I can leave you to share more with the people of the income generating activities that grandmothers are involved in. Thank you.
Thank you, Idah. So as I shared already on the 4 pillars that we work with in terms of our program areas, the child protection, education, economic strengthening, health and nutrition. One of the most interesting one is the economic strengthening, where we train caregivers, the grandmothers in income generating activities. So we train them initially how to form savings groups, which they then select each other and form their own groups where they would save their money and give each other soft loans and continue to, at the end of the year, they can share the profits and the proceeds. Then we have realized that the savings alone were not effective, especially during COVID, because the groups were not able to meet initially before we quickly adapted. So what we have then built in that process is to train the grannies in the specific income generating projects or activities, so that each granny has a skill that they're able to use even during COVID lockdown. They're able to produce a product and sell without necessarily coming together as a group. So the grannies were trained in floor polish making, petroleum jelly making, which they call Vaseline, but Vaseline is a brand name for another company. So it's petroleum jelly that we train them to make, and also to train them in just basic buying and selling. So the grannies, depending on the strength, the physical strength to move around and to hustle, they are either in fruit and veggies, buying and selling. They are also in floor polish making, selling. They are also selling pre-loved clothes. They are also doing recycling, where they go around picking cans and sell to recycling companies. Then the petroleum jelly making is the interesting one. Actually, when you left Idah, one of the grannies said, actually, I'm making a lot of money because we are in winter already. So they were trained to make petroleum jelly, which they package in small tins and bigger tins, and the small tin cost for US $1, and the bigger tin $3. And all these income generating projects, the most important thing for the grannies is that they choose the income generating projects which are less hectic for their age and their levels of energy. So you realize that they actually want things that they're able to sell with minimum movement or with minimum mobility. For example, the vegetable selling, they just put a table outside their gate and sell. The Vaseline making, the petroleum jelly making, they say it's the interesting one, Idah, because they say it's easy to make. You can make it from your kitchen, you can package it from your house, then you just put it outside and you start selling. It's different from the other complicated ones. So this is what grannies are doing in order to survive, buy their food, support their grandchildren in school. Thank you. I'll take more questions if any, but this is in brief what grannies are doing from Chiedza Child Care Centre.
Thank you so much, Sipiwe. I also like the idea of you people actually exposing the grandmothers to international events like, you know, the International Women's Day, the Agricultural Commercial Show, where they take their staff to actually sell. I liked that idea. Thank you so much for sharing. I will go to Vimbai. Vimbai, during my visit, I met with the Pillars of Hope. I really loved those young women and the work that they are doing. And before I left, they said, we want to pause with you. You know, come we pause with you. Come and pause. Energy, courage, the work they're involved in is not easy. And you know, what people said about MASO and the illegal miners, and it was really something that I really would really be good if you can really explain a little bit about the Pillars of Hope and their mission and what they do. It would be nice to share that with the people. Thank you.
Thanks, Idah. So the Pillars of Hope is really clubs of young people that we have as Musasa across the communities, adolescents, mostly girls. We do have a few boys as well, and young people. And really their mandate is to be a link to services for their peers, because we realized that we were missing out on a lot of young people reporting, especially cases of sexual violence. There was a lot of late reporting, which exposed young people to HIV infection, early pregnancy, or even child marriage. And so for us, the Pillars of Hope are trained young people who are among their peers, giving them information around gender-based violence, linking them to organizations like Musasa and others in their communities where they can get services in the event that they experience violence. These young people are different profiles. Some are young people living with their grandmothers. Some are living with a single mom. Some themselves are survivors of violence. They've experienced what it is to go through violence, rape, sometimes physical violence. And so they're passionate, they're volunteers within their communities, and their aim is really to spread the message around access to services and also prevention of gender-based violence. They use different platforms. They organize for themselves sporting activities where they bring their peers to say, let's come together, have a sporting tournament, but afterwards they're able to share key information, give out the toll-free numbers from SASA and other organizations so that their peers know that when I experienced violence, this is what I can do. And for us, they were very critical, especially during the COVID-19 lockdowns, because SASA was not able to be as present in communities as we usually are. And so for us, they became a very important part of the referral pathway for survivors of violence, especially their peers, so that they don't miss out on getting services. So that's really the groups of young people that we have. They're passionate, they're driven, they are in school, some of them are out of school. So it's a really interesting mix. They motivate each other, they keep each other, you know, in check. Sometimes they're able to help each other, mentor each other. And so for us, it's one of the most exciting models of clubs that we have in the community.
Thank you so much, Vimbai. I really enjoyed listening from them. And they made sure they told me where they were coming from. I'm coming from Ward 7. I'm coming from Ward what, and all that. It was really interesting to hear what they were saying and just the way the location is divided and the way that they work. Thank you so much for sharing. Tinashe, when I met the grandmothers in your support groups, most of them had been a part of the group, I think since 2007 and 2010. Are there grandmothers that are still joining now, or have most of the grandmothers been there since the beginning?
Okay, thank you. Yeah, we have grandmothers who joined the support groups since 2009, 2007, like you said. Some of them joined later on around 2010, some joined around 2016, depending on the circumstances, because the work that grandmothers are doing in their community, it continues to attract the attention of other grandmothers. For example, this week, we had a training here at the center, at MASO Center, with grandmothers on motivation. And we have a group of grandmothers who have been under a certain program, under another organization. And they said to me directly that they want to join MASO. So it's an ongoing process. When people witness the good work that we are doing, and they really got to know the concept that the MASO has, particularly within the support group, because our support group model is there to ensure that grannies have got peace of mind, grannies are stress-free. It's an opportunity for them to offer psychosocial support, to offer support each other at peer-to-peer level, with peer-to-peer support. That's the platform which is very safe for them to share experiences, to share ideas, to share challenges, and also give each other advice. So yes, we still have grandmothers that are still want to join the support groups, and I'm due to go to Mkoba 14 and ensure that we have a mini training of what the support group concept, and also look at the programs that they want to do as grandmothers. So they've already organized each other, and they're going to confirm the date for us to come, just to sensitize them on the support group model. So yes, they're still joining.
Thank you so much, Tinashe, for sharing. I think it's good that you really had that motivational training for the grandmothers, because during our meetings, I think the grandmothers were really kind of like struggling to kind of like follow up. Other grandmothers were still in their homes. They were not really wanting to be part of the group. So they had that job of going to find them. So it's good that you still are continuing with those strategies of trying to make sure that the grandmothers can come together. And thank you for sharing. I will actually quickly go to the other set of questions that all of you can comment on. Maybe you can start, Tinashe. What do you see as the new challenges upcoming for the grandmothers?
Okay, thank you. Of late, we have the problem of the COVID-19 pandemic, because back then we've been fighting HIV-related stigma, and also the effects that HIV caused to the communities. But now with the COVID-19 pandemic, it has brought a new dimension of fear and anxiety within communities, where at some point there was some kind of uncertainty whether people were going to make it through the pandemic, or it was going to wipe everyone else. And with that kind of uncertainty in terms of the behavior of children and young people, especially after the schools have been closed for some time, we now have a lot of problems that are coming in relation to children. Particularly, I can give an example of drugs and substance abuse. Some of the children that are still living under the care of grandmothers, they are now involved in drugs and substance abuse, and it's a new problem that has already come, because grandmothers themselves are no longer able to control these children, because it has become like a pandemic sort of, and they're kindly, I think I can say they're scared of them to some extent. Then we also have a plethora of violence against children that we witnessed during the COVID-19 lockdowns, can I say, because a lot of children experienced different kinds of violence. At the end of the day, some of the violence that experienced by children, they later maybe resulted into teenage pregnancies, and these are the children that are under the care of grandmothers. They have no one to take care who can take care of them. So it means it adds into the burden that grandmothers already have. Then we also have this diaspora, Zimbabwe diaspora disconnection kind of during the COVID-19 pandemic, because a lot of people who had migrated into the diaspora, some of them lost their jobs, some of them were locked there, they couldn't even come home to visit their children. So we kind of experienced some, can I say, diaspora orphans, and even in terms of remittances that they were bringing back to support also their families back home, they were reduced. At the end of the day, we had this kind of increased pressure on grandmothers. And in terms of livelihoods, it also affected the viability of their livelihoods, because the majority of our grandmothers live on hand-to-mouth basis, where they go, some of them are into buying and selling, some of them are into maybe nutrition gardening, village savings and lending schemes. So during the peak of the pandemic, those informal activities were affected because they were mainly targeted by the COVID-19 lockdown, to the extent that we had to, at some point, to request to Stephen Lewis Foundation that we need to also procure some food hampers to also provide to some of the families that were in critical circumstances due to the pandemic. So it has brought a whole new dimension. And like the support group that you visited, Progress Support Group, it kind of stopped a bit when COVID-19 started, the lockdown started. They stopped for about 4 months without any activity they were doing. So we then engaged and said, you know what, in as much as we have these problems of lockdown going on, you still need to eat. So we need to come up with strategies and mechanisms to ensure that we continue our income generating activities within the operational environment, so that we have, some kind of a livelihood. So that's when they started as a group, and I'm happy to say that right now we are talking about a whole different story, because they're at another level right now. So those are some of the problems that came and kind of disturbed the progress that we had already made in relation to Granny's welfare and also Granny's activities. Thank you.
Thank you so much, Tinashe, for sharing. I think we'll go to Sipiwe. Sipiwe, what are the current needs of grandmothers and their grandchildren in Africa? Maybe you can take up that.
Thank you. So I would say, firstly, the need for them to adapt to the new normal. For example, the education sector, or right now, most of the children are learning with face-to-face and also virtual. So the grannies do not have adequate resources to support the new normal for the education of their grandchildren. Even if probably we provide them with smartphones, they are also not equipped to be able to support online learning. So we have realized that for the children under the care of grannies, they are so much behind in terms of catching up with their education activities because of that huge gap. So the grannies are also facing a lot of anxiety and not sure of how to support children, because schools trying to decongest, they are actually giving children slots to learn, probably 3 days face-to-face, 2 days online. And the grannies are not able to provide for the mobile phones and also the skills to support online learning. Also, right now, the grannies require a lot of support in terms of their health. because of the deteriorating social service delivery in the public sector, in the government hospitals, where for you to get a service, you need to actually to pay for almost everything. Maybe what they can offer, there's free consultation, but even the card to be able for them to write a prescription, you have to buy, and whatever medication, even a painkiller, you have to go and buy. So the grannies are also faced with this huge burden in terms of providing for their own health and also the health of their grandchildren, some of them who are HIV positive. Then also what we have noted is they also need emergency food support, in as much as we are providing them with skills to do income generating activities. We have noted throughout COVID and now and beyond that, I think we need always to provide for supplementary feeding for our grannies so that we reduce the burden of them trying to raise all the income that is required for their rentals, for their health, for the education of their grandchildren, and for everything else. So if at least we meet them somewhere by providing food hampers, we do really help them. So also after the COVID now, they also need support. There's an increased demand for school fees support because there's also an increase in terms of school fees because the economy of Zimbabwe is continuously going down and there's so much increase in terms of school fees, which is probably an issue across sub-Saharan Africa where more and more children are really getting out of school and the grannies, they need support to maintain their grandchildren in school. I think we also have one of those responses as an organization where we are targeting children who have really fallen out of school or who have failed to start school at age 9. And so far our enrollment is around 175 in just a small community. So you can imagine in Zimbabwe, in sub-Saharan Africa, how many more children are out of school. It only shows that the grannies are not able to maintain their grandchildren in school. Then one of the important things that we have noted after COVID in terms of their current needs is the support for them to restart their income generating projects or to reboost what they've been doing before COVID, because some of them had really gone down, to close their groups, to close their income generating projects, or to use their profits for emergency needs because they had gone on lockdown. And sadly, when there was lockdown, all of us, we ran away. We went home and we closed ourselves in our houses and we had supplies. You know what? After 3 weeks, 4 weeks, we began to think about them to say, if some of us we are employed, we are under lockdown and able to supply food on our table, how about the grannies? That's when we stepped out and say, okay, let's go and try to follow the COVID protocols and see what we can do. That's when we started providing the food support to the grannies. So they need a lot of support, even psychosocial support. Some lost their relatives during COVID, some lost their income. So they also need that psychosocial support. Those are the greatest needs for grannies at the moment.
Thank you so much, Sipiwe, for sharing that. Vimbai, maybe you can answer this question. What is the biggest thing that you have learned throughout COVID and these lockdowns and its effect on your programming and communities? Vimbai?
Yeah, thanks, Idah. I think for us, one of the biggest lessons from COVID is the need for us to be adaptable as organizations. I think we were taken by surprise, but it revealed a lot of work that we still need to do in terms of planning for emergencies, planning for eventualities as organizations. For us, because we don't have a lot of funding that is flexible, I think it really revealed how tied down we are by the funding modalities and how we need to think more as institutions around our sustainability, around what we can do outside of the strict funding regimes that we had so that we are able to respond quickly. I think we had to adapt almost overnight as organizations to say, if we can't go to work as usual, if we can't be on the ground programming as normal, so how do we change the way that we work? But I think we know that it's not ending with COVID. there is more that is coming, most likely, and we've learned from COVID that it can happen very unexpectedly. And so for us, we started thinking around new ways of planning even our reserves as organizations, so that when we have any emergency, we're able to respond quickly. For us as well, what also came out strongly is the need to strengthen our community-based structures, because we are not always going to be able to be on the ground. But there are the grandmothers, the mothers, the children who are on the ground in the community every day. And so how do we strengthen them and not always rely on the ability of ourselves as organizations to be present, but how do we prepare those community-based structures to respond, and in our case to violence as it happens, because we saw statistics were telling us that gender-based violence has shot up. But here we are, most of us saying we're working from home. We couldn't close shelters. We couldn't close our counseling centers. We just had to adapt. So I think from there, we're learning a lot of lessons around how to be better prepared and how to think more around sustainability for our institutions and our community-based clubs.
Thank you so much, Vimbai, for sharing. Thank you. Ruthen is back.
Yeah, so I mean, first of all, thank you so much, everyone, for sharing all this exciting stuff of the programs that you're doing and sharing some of the challenges that are coming up. We have a few questions from the audience that we'll lead into. So one of the questions was, have most of the schools reopened, and are your organizations finding it harder to get girls back in school since COVID? So we can anyone can jump in about the school closures in their areas and how that's impacting your work.
Yes, the schools have opened this year. It's been much better because the first term they opened in February, and the second term they opened in May. It's almost like the school calendar is coming back to normal. We are running an out-of-school program, but we still follow through the government calendar. And what we have noted was some girls eloped, or they went into early marriages or early pregnancies during COVID, and it was difficult to bring them back to school. I think we really faced that as an organization.
Yeah.
If I can just add to, sorry, go ahead, Tinashe.
Okay, yeah, I think schools have reopened, but we are also experiencing a number of girls who are pregnant, and I understand the government has got the Education Amendment Act of 2020, which is saying even girls that fell pregnant can go back to school even with their pregnancy, and they're given maternity leave at some point. But then the biggest challenge is that particularly in Kwekwe and Gweru districts, we conducted back to school campaigns, help in partnership with the Ministry of Primary and Secondary Education, with other partners as well. But then the problem is now that they are facing a lot of stigma in schools, because other children are saying, we can't, sit on the same bench with these people who are with these children who are pregnant. And from the community perspective as well, some other parents are not even accepting that these children should be accepted in school, because their thinking is that they are going to influence other children into doing what they did, which is not the actually the case, but that's what they feel. And also in terms of educational support, there is no support that has been channeled towards supporting these children. At the end of the day, I remember when we were conducting these back to school campaigns, there was a promise that the organization, the government rather, is going to take care of their school educational needs. But then up to now, you'd find that some of them are dropping out due to financial constraints. Some of them are dropping out because of stigma-related issues. And some of them are dropping out simply because their spouses do not want them to go back to school. And some of them are dropping out because the parents are saying, you are old enough. If you are old enough to get pregnant, it means you can take care of yourself. then we can't support your education. So these are some of the challenges that still need to be addressed in as much as the schools have opened. And also, I think Spio highlighted the issues of school fees. The school fees has hiked a lot. And right now, there is speculation that, examinations fees is going to be very, very exorbitant. And if the government doesn't chip in, it means we are going to have a problem in terms of access to children, access to education for schools, for children, particularly the examination, because I think with government supplemented figures around $11 per subject at ordinary level, and in private schools it's going to be around $24 per subject. Considering that children, some of them are going to be writing about 8 subjects or more, it's going to be a challenge, especially given the economic situation we are currently experiencing. Thank you.
And Vimbai, you were going to say something on that as well?
Yeah, I think very similar to what my colleague said. There's really a disconnect between, the rhetoric that schools are opened, it's getting back to normal, and the impact that COVID-19 has had on the economies of the ordinary Zimbabwean. And so especially we find with girls who had to drop out because of pregnancy. In our shelters, we definitely saw an increase in the number of young girls who had been raped or had been forced into child marriages just because of the economic situation. So I think that disconnect is really something that's glaring, even though we are talking about schools being reopened.
And there's a couple other questions, and one just came in through the chat that's related to this question, so I'm going to jump there. So are there school fees for all primary and secondary schools, and is there interest on the part of the government to work on free public schools to make schools accessible, or what is the situation there? I mean, anyone can answer there.
Okay, in all primary and secondary schools, user fees are required. School fees is required because as MASO, we've got another program where we're supporting obviously through educational assistance, and we're actually paying school fees in both primary and secondary. In as much as it is education in principle is free at policy level, but practically it's not happening on the ground. So it's something that it's a policy that still needs to be implemented.
Yeah. So one other question that was towards you, Tanashi, but I think it applies as well to everyone. You mentioned that the pre-pandemic grandmothers faced a lot of stigma related to HIV and AIDS and self-stigma. And do you feel that the COVID-19 pandemic has resulted in an increase in that stigma and discrimination that they feel, or how has that impacted the stigma?
Yeah, I feel like it kind of reversed the gains that we had made during the pre-COVID-19 era, because we were working on the stigma issues through the support group model. We were saying, grannies come together, they discuss their issues, they cancel each other. At peer level, we are also meeting other grannies, maybe who are also HIV positive, maybe who also lost their children due to HIV and AIDS, who are also taking care of grandchildren. So it was something that it was a platform for them to support each other at peer-to-peer level. But then with COVID-19 now, maybe converging for support group, it became a challenge. At the end of the day, we had grannies who were, confined in their homes, and it brought, I think, a whole new dimension of anxiety, so to speak, because there was this say where they were saying all elderly people were more vulnerable to COVID-19 compared to younger people. At the end of the day, it brought a lot of pressure, to grandmothers. And I remember at some point during the early lockdown era, we had our network providers like Econet were sending text messages on daily basis, updating us on the numbers of people who have tested positive for COVID-19, the number of deaths, but no one was providing in terms of, counseling. So it was really a problem, because if we have such kind of information and we don't have information that, you know, comforts people, it brings a lot of anxiety. And in terms of decisions that are made by people, it becomes a challenge. So yeah, it kind of brought a new dimension of anxiety, which was kind of a bit different from HIV.
Mm-hmm. I can see that the sun has gone well down now for you, and it's getting dark. And I want to thank you again for giving us this time after your work hours. We know it's getting into the evening. Just to close off, I'll ask one question, and maybe we'll start with Spiwe, and everyone can have a chance to answer. Given all of these challenges that are coming up with COVID and lockdowns, and we know the need is great, what motivates you to keep going? What gives you hope for the future?
What motivates me is to see the change that is happening in the lives of the children and the caregivers. Especially for my work, I interact with the children and the caregivers on a daily basis, such that coming to the place here where I work and I don't see them, I don't feel motivated. I once said to somebody that even now, I think it's a very difficult decision for me to be able to be in a workspace where I talk about these issues without necessarily directly interacting with the children or the caregivers themselves. You know, like where you work, you know, somewhere in a big office, and you are just talking about grandmothers, HIV. I really struggle. So to see them every day, and they remind me that I have something to contribute into their lives, it keeps me going, despite the hardships that I face as a leader in terms of providing for their resources and everything. Seeing them and making them realizing that they are happy, even they look forward to us as part of their solutions in their lives, it really keeps me going.
Mm-hmm. But Mbai, how about you? What motivates you?
I think very similar to Spiwe. You just need to spend a few minutes at Musasa. You'll come across survivors, more so when you visit the shelter. And Idah had the privilege to go to the shelter, where you see the reality of the impact of your work. Like Spiwe is saying, it is not just about, you know, talking about it, but you speak to the survivor, you see the reality, you see that pregnant child who's living with the grandmother who doesn't know what is going to happen when this baby is born. And you keep pushing and you keep working to say, we have to keep Musasa alive so that we are able to touch these lives. So for me, it's just coming face to face with the reality of our work that keeps me going.
Mm-hmm. Yeah, I think that's an excellent place to end it. I mean, that's you know, that's what we are constantly trying to do, to remind people that we're still here and our partners are still here, and we're committed to staying with them through all of the difficulties and all of the challenges, and keeping this on everybody's mind. So again, I just want to say such a huge thank you. This is really an amazing opportunity, and I know everyone is loving to hear from you. Our supporters and members of the Grandmothers Campaign always love to hear directly from our partners and from Idah. So thank you so much, and thank you everybody for attending. Again, if you lost connection, don't worry, there will be a recording that will be sent along, and you will be able to share it with anybody who's interested. So again, thank you so much, and good morning, good evening, and good night.